next speaker. Thank you. So we now call upon NguyeN HIEN, and the topic that will be spoken of is establishment of the Vietnam Society of Ophthalmic, Plastic and Reconstructive Surgery. Again, I'm sorry if I pronounced your name.
Names?
Okay. Please go.
Okay. Hello, everyone. My topic today is establishment. My topic today is establishment of Vietnam Society of Ophthalmic, Plastic and Reconstructive Surgery (VSOP). And I'm Dr. Thu Hien from Vietnam National Eye Hospital and AIOS Executive Council. There are no financial conflict of interest to disclose. Back to the current situation in Vietnam. In my country now, we have 2,000 ophthalmologists in Vietnam, with the ratio is 18 ophthalmologists per 1 million people. And in my country, we have some sub-society for ophthalmologists, but the biggest society is VOS, where the Vietnamese ophthalmologists can exchange knowledge or share experience. And in my country, we have around 40 oculoplastic surgeons have supply licenses, and I have conduct survey for over 300 ophthalmologists in my country, and so the result of interest in the oculoplastic and reconstructive. In my country, there are some doctors who can perform oculoplastic and reconstructive, including otolaryngologists, dermatologists, common surgeon, plastic surgeon, ophthalmologist who can perform oculoplastic. And the outcome of my survey is so that almost people who want to make the survey or in order to present their result under the scientific conference, and the more detailed question for the attendances about how difficult they get whenever they make the conduct or survey or presentation is that they lack of mentors, lack of methods, lack of data, or lack of patience. And 73% of attendance show the desire to participate on the oculoplastic measure. And in some Asia Pacific countries, there are some countries who their own society for the oculoplastic and reconstructive, and they are member of AIOS. But in my country, up to now, we don't have any. And there's a desire for the attendance who want to attend to some kind of conference. So, thanks to LDP staff as well as my classmates, we have conduct the procedure, the establishment for VSOP, including 6 steps. First, define objective and scope activities, and the second is establish the founding committee, and the last, and then draft the society charter and obtain approval from relevant government authority, and organize the inaugural congress, and final is register operation and implement program. And now, from the beginning, and now we start in the first step. And we still have a wait time for finish the final step. And since then, we wait for the approval from the government authority. And then we have some preparation activity, including prepare some kind of meeting or conference to connect the ophthalmology in my country, in the north, in the middle, and in the south, even the head of ophthalmology hospital, as well as the medical university. And we also do some activity including lesson for the young ophthalmologists, online or offline, or workshop to transfer skill for the young ophthalmologists. In the international activity, we also connect with the AIOS society, as well as join to some international scientific conference. And we also send some young Vietnamese speakers to the Young Innovation Forum, with whom hosted by some my colleagues here. And whenever we conduct this study, we found some difficult, including lack of experience, lack of funding, or some skill. And we have asked for the absorb as well as the valuable suggestion from the LDP staff, faculty. And whenever we launch our initial activities for my society, we hope to receive the agreement as well as support and collaboration from both of you here. And thank you for listening. If you have any questions, please ask. Thank you.
So anyone with any comments, questions? I think it's an important endeavor, because as our ophthalmology in every country starts maturing, you always feel that there is a need for subspecialty societies so that you can have more focused discussions.
Yeah.
These societies often are smaller than something like, say, an APAO, so lesser number of people, more likelihood of personally meeting each other and exchanging ideas. So one good way to incorporate is, as you create your structure, obviously it would have the national faculty as a part of different boards, but leading people around the world who are landmarks or benchmarks in ophthalmology or oculoplastics can also be taken on board as advisors, so they can guide you all as to how the society, once it is formed, what should be the path that it should take, and they can handhold your initial office bearers, so that with time then you become a self-sufficient machine, one generation after the other, nationally helping each other. So in the initial days, always nice to see if there can be involvement of some international people as advisory board members.
Yeah, thank you.
Thank you. Thank you for the presentation.
It's also very nice to have these societies so that you can formulate guidelines, protocols, and then you can apply it everywhere.
Yeah, thank you.
Thank you.
Yeah.
Very nice presentation.
Yeah, thank you.